This is Tracy again. Welcome back to NurseEdScholar. And today I have a question for you. Are you confused about SIADH and diabetes insipidus? Because if you are, don't worry, I got you. Because you're not alone. These are two disorders that are often tested together because they deal with fluid balance and ADH, which is antidiuretic hormone, but complete opposites. Okay, so in this video, I'm going to break them down, SIADH and diabetes insipidus, in a simple, memorable way. And by the end, you'll be confident to tell them apart. But before we get into those two, let's just do an ADH refresher. So, what is ADH? ADH, like I said, is antidiuretic hormone. And so it's made in the hypothalamus, stored in the posterior pituitary gland, and its main job is to tell the kidneys, hold on to water. So think of ADH, or antidiuretic hormone, as it's telling the body, don't pee, hold on to the water. Okay? Now, with too much antidiuretic hormone, the body's going to hold on to too much water. With too little ADH, your body is going to lose water like crazy. And that's really the foundation of SIADH and diabetes insipidus. So let's start. Let's start with SIADH. Now that acronym stands for Syndrome of Inappropriate Antidiuretic Hormone. So the key problem is too much ADH, too much antidiuretic hormone. So what happens? The kidneys hold on to the water even though the body doesn't need it, okay? And what's going to happen? Your body has too much water, you're going to have fluid overload and diluted blood, okay? So there's a little mnemonic that you can use. S for soaked, so the body gets waterlogged, it just has too much fluid. I is for increased ADH, antidiuretic hormone. A is for added water and low urine output. D is dilutional hypernatremia. So the sodium in the body gets watered down. And H is for high specific gravity because you're going to have concentrated urine. So those are the things that you're going to look for. Now the signs and symptoms: low urine output. So the urine is going to be concentrated because the body's going to hold on to that water. Hyponatremia. Like I said, the sodium gets diluted. So what are you going to see on your patient? Confusion, seizures, headaches, okay? And you're going to also see fluid overload. The patient is going to gain weight without edema. If you check their pulses, they're going to have bounding pulses. So what are we going to see on our treatment plan? What are the doctors going to prescribe? They're going to prescribe fluid restriction, hypertonic saline, and in my other video about IV fluids, hypertonic, when it's infused, it goes to the blood vessels and it pulls all of the water out the cells. So you'll see hypertonic saline, and then medications like demeclocycline or vasopressin receptor antagonist. Okay, so that's SIADH. Now with diabetes insipidus, the key problem with that is not enough ADH. So the kidneys doesn't respond to it. So what happens? Your body can't hold on to water. So the kidneys are letting go as much fluid as possible, and you're going to have diluted urine. In the result, you lose too much water, patient's going to be dehydrated, and their blood is going to be concentrated. So a quick memory trick is D is for dehydrated, and I is for increased urine output. So what are you going to see on your patient? Polyuria. They can urinate up to 20 liters a day of diluted urine. They're going to have polydipsia, extreme thirst, okay? They're going to have hypernatremia because now they've lost all of the water, so you're going to have a high concentration of sodium. So the patient may exhibit irritability, weakness, and seizures. And then they're going to have a low urine specific gravity because all of the fluid, and so the urine is going to be very diluted. So what are you going to see in your patient's orders? You're going to see orders to give them back the antidiuretic hormone with desmopressin or DDAVP for diabetes insipidus. You're going to see replace the fluids that they've lost, and you may see nephrogenic diabetes insipidus. You may see orders for thiazide diuretics and a low salt diet. And so let's put them side by side. SIADH, too much antidiuretic hormone, which leads to water retention, which leads to low sodium and concentrated urine. And then when we're looking at diabetes insipidus, you're going to have too little ADH or antidiuretic hormone, which leads to water loss, high sodium, and diluted urine. So think of them as opposites. SIADH, soaked body, salty, blood, diluted. And then diabetes insipidus is dry body, salty, blood, concentrated. And so the bottom line for all of this is SIADH, water stays in. Diabetes insipidus, water drains out. So if you can remember soaked in SIADH, dry in DI, then you shouldn't confuse them again. So that's it. If you've liked this video, hit the like button, subscribe to NurseEdScholar for more nursing concepts and school content, and comment below, if there's something that you want me to cover with endocrine disorders or any order. And so I thank you again. Thanks for watching. Please tell a friend, subscribe, because like I've said before, it really helps the channel. And good luck in nursing school from NurseEdScholar.